Hello Maricos, welcome back to my channel. New day, new video. So we'll be continuing with our series of congenital heart diseases. It's the day 3 and I hope you have already revised the past 2 videos. And now we'll be discussing about the patent ductus arteriosus. So you should know that patent ductus arteriosus is basically the it is most common defect in females. Okay, it is most commonly seen in females, and also in the preterm babies. So why in the preterm babies? Because of increased chance of hypoxia, right? These babies, they can have patent ductus arteriosus, right? And also there is increased incidence of patent ductus arteriosus that is seen with the increased incidence seen with the, we already discussed that this congenital rubella syndrome. We already discussed this in our past video, right? So it is the most common acyanotic CHD in females, most commonly seen in females, preterm babies, and also increased incidence with congenital rubella syndrome. Right, now let's discuss the pathophysiology in patent ductus arteriosus. This is the normal heart, and you already know what is happening in the normal heart, right? This is the aorta and this is the pulmonary artery, right? Now what happens is, now there's a defect, there's a connection between the aorta and the pulmonary artery, and since you already know that aorta has very high pressure, hence for the blood will move from a place of high pressure to low pressure, and the blood will be coming from aorta, will be shunted from the left side of the heart, that is from the aorta, to the right side of the heart, that is the pulmonary arteries. And because of this, through this patent ductus arteriosus, there will be turbulence and it will be causing a murmur that is called as the continuous machinery murmur, right? So we'll be hearing a continuous machinery murmur in a patient of patent ductus arteriosus. Now here also you can see that this is the connection, the patent ductus arteriosus, between the aorta and the pulmonary artery, right? Now we already discussed this in our past video, that the ductus arteriosus is basically a structure which normally is present during the fetal life, and after birth it dissolves, functionally it closes within 10 to 14 hours after birth. It closes, and anatomically it is closing after 10 to 21 days after birth, right? So patent ductus arteriosus is the last structure to close functionally, okay, and the first structure to close anatomically, okay, the last structure to close functionally, right? This we already discussed in our past videos. Now let's move to the clinical features that we already discussed, that we'll be seeing a continuous machinery murmur. What is the location of this murmur? Where you will be seeing this murmur? This murmur is seen in the Gibson's area. So where is this Gibson's area? Gibson's area is in the second left intercostal space at the parasternal location. Okay, that is the Gibson's area. Now what are the differential diagnoses of machinery murmur, और हमें कहाँ दिखते हैं ये? So we can see it in the aortopulmonary window, in RSOV. RSOV is ruptured sinus of Valsalva. Then they are also seen in AV malformations and in collaterals like coarctation of aorta, right? Now let's discuss the treatment plan of patent ductus arteriosus. So the treatment of choice is mostly surgery, and we do a catheter based closure, okay? So catheter based closure with the help of an occluder or a coil closure. So you can see here that this is a coil, and with this we can do a coil closure, or we can also go for a device closure of PDA, right? Now if we talk about the medical management, then it is to be done within 2 weeks, within 2 weeks of birth, only in cases of preterm. Okay. Now what are the uses of prostaglandin inhibitors in case of patent ductus arteriosus? Now just letting you know that in cases of prostaglandins, they're required for maintaining the patency. Prostaglandin E2 is required for maintaining the patency of this ductus arteriosus. Okay, so basically like in those babies who are preterm babies, है ना, and the mother has to undergo a delivery because of any XYZ reasons. Okay, in such cases we need to close these ductus arteriosus, and in such cases we give the mother NSAIDs so that the child does not born with a patent ductus arteriosus, because it has its own time of closure. So if there will be a preterm delivery, and we already know that the delivery will be a preterm, so we give the mother NSAIDs so that we can close the the ductus arteriosus. So what are the uses? Use of prostaglandin inhibitors. So prostaglandin inhibitors are NSAIDs, है ना, इन्हीं को तो बोलते हैं prostaglandin inhibitors, NSAIDs. So they can be used in cases of patent ductus arteriosus because they will close the ductus arteriosus. So you can either go for ibuprofen, or you can go for indomethacin. Now remember that both of these have equal efficacy and equal success rate, a success rate of around 70 to 80% in a case of patent ductus arteriosus. But still, ibuprofen is better preferred in India because it has lesser side effects like that of necrotizing enterocolitis. So such side effects are less common with ibuprofen. अगर आप NEC पढ़ोगे, that is necrotizing enterocolitis, उसमें लिखा हुआ है that one of the risk factors for NEC is when in the early life the child is being exposed to NSAIDs. Okay, so obviously a child who is to be born in a preterm age, or we know that the child is having a patent PDA, so in such cases we'll have to expose the child to NSAIDs. Okay, now let's talk about the complications. So there will be pulmonary congestion. Why? Because the blood is being shunted from the aorta and is now coming to the pulmonary trunk that will reach the lungs, and henceforth it can cause congestion in the lungs and can cause recurrent pneumonia. There can be congestive cardiac failure which occurs at around 6 to 10 weeks of life. And what about Eisenmenger syndrome? Yes, Eisenmenger syndrome is also seen here, where you will see what? You will see that there is reversal of the shunt, right? Reversal of the shunt that will occur from the pulmonary artery to the aorta now, right? That means a deoxygenated blood will be mixing with the oxygenated blood, because aorta is carrying the oxygenated blood to the systemic circulation, and the pulmonary artery is bringing deoxygenated blood from the right chamber of the heart to be taken to the lungs. So now there is mixing of the deoxygenated blood to the oxygenated blood. Henceforth, what will happen? The oxygen saturation will decrease, and there will be decrease in the oxygen saturation due to mixing of the blood. But you need to know that this decrease in the oxygen saturation in the mixing of the blood, it occurs in the descending aorta, not in the whole of aorta, but in the descending aorta. Why? I'll just show you, right? And because of this, the lower limbs, because the descending aorta is taking blood to the lower limbs are cyanosed, they have bluish discoloration, and the upper limbs are normal, they are pink, right? So this, that where the lower limbs are cyanosed while the upper limbs are pink, this is known as the differential cyanosis. So differential cyanosis is a characteristic feature of patent ductus arteriosus. Now why is this happening? Now see here that this is your aorta, okay, right? Now this is your patent ductus arteriosus here. So this is your arch of aorta, this is your ascending aorta, and this is your descending aorta. And you can see here we have the pulmonary artery, which is now, because the blood is being shunted in Eisenmenger from the pulmonary artery to the aorta, so blood is going here and it will move down. It will be shunted to the descending aorta, right? And henceforth there will be differential cyanosis. I hope you understood the concept behind patent ductus arteriosus. If you guys have any kind of doubts, please comment below. We'll discuss it further. And please support my channel. I'm new to all this, and I hope you are liking a little bit of such content for passive learning. Okay then, see you in the next video.